Hey guys, it's Dr. Masud. See this right here, guys? This is actually 5 pounds of fat. Now it's heavy, and I'm a pretty strong guy. But could you imagine if you were walking around with 5 pounds of fat all day long? I mean, this makes a great pillow, but really, you're gonna get really tired if you're having all that fat. Now, the other thing I wanted to let you guys know though, a lot of you guys, some of you don't have as much fat as you think on your belly. You don't. Sometimes if you're noticing, if you're looking at your belly or your husband's belly and it's distended, some of that might be fat, but the other part of it's going to be inflammation. And so what happens is certain people eat certain foods that are just not good for them. And so what the body does is it creates inflammation in there. And so then it gives you like a distended or a very hard belly look. So there are some things that you can do right now if you're suffering with inflammation. Number one, I'll put it to you this way. If I had a hammer and I was sitting there hammering my thumb with it all day long, what am I going to get? My thumb's going to get, it's going to get inflamed, right? And so it's going to swell up. Well, the thing that I'd want to do is I'd want to stop hitting it with a hammer. And so that's causing the inflammation. Well, that's what's happened to a lot of you guys. So you guys are eating certain foods that you're hitting yourself with a hammer and your body doesn't like it, so it's inflaming. But the thing is, you keep hammering it into your mouth and your body keeps inflaming, and it's not good for you. Okay, and sometimes other of you guys don't know what foods you should be eating or not eating. And sometimes it's food combinations that could be causing the problems. And so a lot of times what we do at our clinic, we like to test you to see what's causing the food sensitivity and or the food allergy. And there is a difference between food sensitivities and allergies. Food allergy would be something that you'd have a really bad reaction like peanuts, an immediate IgE reaction. Food sensitivity would be a delayed reaction, like an IgM reaction, where you don't notice, you don't really have much of a problem when you're eating it, but a couple days later, there's certain antibodies in your blood that are elevated because you shouldn't be eating that type of food. And so there's tests that we can actually do for you for that, or find a functional medicine doctor in your area, and hopefully they can do some of those tests as well for you. The other thing that we like to do is that will help with the inflammation and help get rid of sometimes belly fat and your blood sugar and make you feel good, and maybe even be looking better because you're getting less bloated and less water retention in your body. And so the other thing you could do is sometimes I use at my clinic, it's called Tumero, and it's a liquid. I buy it from California. It works amazing. It's much better than the turmeric itself. And I love it. It comes in a syringe and you just put it in your mouth and you keep it in the refrigerator, 5 milliliters, and it works amazing, not only for joint pain, your body, but inflammation. I've noticed a lot of patients that actually start taking that Tumero, their swelling goes down in their belly. Other things that we like to do is that we like to do, certain digestive enzymes, and digestive enzymes are not one is for everybody. There are certain ones that work better for some people, and there's certain ones that make no difference for other people. So we try to figure out that formula, that magic formula that's right, going to be right for you. Other times people, could have hidden infections. And so, if you're having a hidden infection, you're not going to know it unless you do a stools test. And I'm not going to look at your stool, but I will send it out to the lab, and they'll tell me what's going on. And then from there, we can figure out a formula to help you get rid of hidden infections that you may not know of. Other times it's going to be hormone problems. If you're stressed out of your mind, that's going to make your gut inflamed, and that's not going to be good for you no matter what food you eat. So guys, there are a lot of avenues out there of what could be causing belly fat. I'm just giving you a couple things and a couple suggestions that you might want to consider. The takeaway from all of this is that testing is critical because it tells you it's better to test than to guess. But if you're not going to do any kind of testing, you're not going to do anything whatsoever, then go find somebody that can at least help you get the results you're looking for, because it's not like Lucky Charms, it's magically delicious and it magically appears. It doesn't happen that way. You actually have to do something. So hey, I hope this helps, guys. I hope to give you some ideas what you can do to help yourself get healthy. All right, take care.